Sacituzumab govitecan, on the other hand, our two most prominent side effects are diarrhea and then neutropenia. So diarrhea, neutropenia, and datopotamab, obviously with the mucositis in the eye. So I think it's important to remember they're both TROP2 targeted ADCs. They both have the same payload, very different profile. So with sacituzumab govitecan, the diarrhea I actually find to be very polarizing in patients. It's not a neratinib or a lapatinib diarrhea or even a abemaciclib diarrhea where you can kind of guarantee that everybody's going to have some diarrhea. It's just a question of how bad it is. Sacituzumab govitecan either have patients that don't have any or they have it and struggle a little bit. It's kind of this either or, which I find a little bit interesting. I'm curious if you had the same experience. And then the neutropenia, really patients don't feel that. I luckily haven't had any patients that have really gotten in trouble with infections and febrile neutropenia, and I've not had any deaths, although I feel like I have to knock on wood with that. But the problem can be that it's day 1, day 8. And so it can present some problems in terms of use of growth factor and things like that. You can't use growth factor between the day 1, day 8, and so we tend to use it after day 8 long acting to try to drive that white blood cell count up for the next cycle. But I think you bring up a good point. We've had it around for longer, and so people are kind of starting to get comfortable with it.